My name is Kathleen Corey. I'm with the World Economic Federation, and we have an entire huge economic overarching plan to look at the various problems that are affecting, the world. Let's not be small. But we also recognize that it's important to have people working as experts in their fields. And one of the fields that affects us deeply, as it does every American, is healthcare reform, or actually providing healthcare to the people of this country. And I'm speaking today with Dr. Joseph Jarvis, particularly about the book For the Hurt of My People, Original Conservatism and Better, Simpler Healthcare, which I recently read and inwardly digested and had many reactions to. And one of the things that I wanted to bring up first with Dr. Jarvis today is the experience that we have in attempting to create a green capitalist solution, both to climate change and to economic problems such as healthcare, veterans issues, education, poverty, is that we are immediately labeled as socialists. And that oftentimes simply caring about the poor, the sick, and the imprisoned is enough to get you accused of being woke or socialist. And I would like for you to talk about how you address the stigma of socialism and socialized medicine, and how to frame the push toward allowing the states to create single payer systems with moderate or even conservative values, and particularly your values.
Well, thank you for that question. And I do get that comment, that pushback, if you will, all the time. I've been an advocate for single payer healthcare from a very conservative background now for about 30 years in a state that is very conservative, the state of Utah. So when I speak publicly about the issue of health system reform and propose a single payer solution, lots of people assume, because they've been trained by the propaganda from the health insurance industry, they've been trained to assume that that's socialized medicine. And you have to educate them about that. And the response is really direct and straightforward at the policy level, and that is, it's not socialism. I don't advocate for anything other than public funding for private healthcare delivery. We publicly fund healthcare in the United States, and we have been doing so for 75 years. The tax policies of the federal government and many of the policies in all of 50 states fund healthcare. That's how we get the money to pay for not just the care for the Medicare and Medicaid populations and the Indian Health Service and Veterans Administration and you name it, all the other acronym soup of programs that fund the care benefits that Americans enjoy. But the private health insurance from employers is supported largely by tax policy. There's a huge tax benefit to an employer for spending money on health benefits. That's been true since the Second World War. That's a $500 billion line item in the federal budget. So don't tell me that there's a private financing of healthcare. That's never been true. So I'm not proposing anything new on that. And I am not trying to change it into a publicly owned enterprise. Socialized medicine is when the government owns and operates the means of providing the healthcare, meaning the hospitals, and employs the physicians and nurses. And that's not what I'm proposing. I'm proposing private healthcare delivery. It's not socialized medicine. Let's get it right. Now that pretty much silences the critics. That what else can they say? But you mentioned the background of religious feeling, which is often intoned. You know, we need to take care of ourselves. People need to be self-reliant, is the way that they put it. And I agree with that. Self-reliance is a very important part of the economy. We don't want to all be dependent upon, so to speak, the state for everything that we need. But we can't forget, I don't think anyway, we shouldn't forget that all of the major religions and even the humanitarians, if you will, who don't have a belief in a God, everyone agrees that we should be taking care of each other. There isn't any argument with that. I use the Bible to illustrate that because that's the religious document I know the best and I was raised on, and I am a true believer in an all-knowing and all-loving God who sent his son to earth to be sacrificed to help all of us become better people. So I'm a Christian, and the Bible is full of directives specifically about health and about the need for all of us to care for each other. Jesus of Nazareth's calling card, the thing he used to show people who he was and what he was about, was the healing of the sick. And we need, as a nation, we need to be on that same page. The final teaching that Jesus of Nazareth made in public was about how you need to help even the least of these, my brethren. That's the quote from the King James Version. And he included in that list of things that you need to do to visit the sick. So I have absolute no compunction about going into this with any group of believers, and I'll take them all on, regardless of who they are, where they're from, and suggest that they look at their own sacred writings, and they'll realize they'll see there, in their hearts, they will see written the need to take care of people.
I've been wondering how much success that you have. Clearly, you're very passionate about it, and some of us are better at that than others, but it seems to me crucial to this particular conversation in the desire to share with others a not necessarily liberal view, liberal as is labeled by politically. I have a liberal arts education. I have a PhD in French literature. I am the definition of liberal by that sense. But when it comes to politics, that's not always the case. But I also share this project with my husband, who grew up relatively conservative in the classic sense and finds himself unable to function under that banner any longer because of how much the political parties have changed, and that this conversation needs to be outside the parties, but more particularly to what we share amongst ourselves, which, as you say, is even a secular humanist, by definition, is a proponent of humanity. And some of us, it's required by our religion that we should take care of the poor and the sick and visit the people in prison. And there are other religions that may say things a little bit differently, but mostly when we come down to that and step out of politics, that's where we end up. And that's the problem, is the politics.
I join you in that remark that you made about how things have changed. I grew up a conservative. I consider myself still to this day a conservative. I was raised in the state of Arizona. My mother had a very conservative background as an Army brat. Her father was a career Army officer. And I shared in that heritage. The major political leader in Arizona back when I was growing up was Barry Goldwater. I'd consider him an original, is the term I use, an original conservative in the United States, in the sense that Abraham Lincoln and Ulysses Grant and Teddy Roosevelt and Eisenhower were all original conservatives. They had a clear vision that you preserve the things of the past that provided and transmitted values that had been harvested from millennia of human experience, such as what you find in the Bible, that we share with many, many societies across the world. You preserve those and you teach those values and those principles for living, because those are the successful ways of moving forward. From my perspective, they came from God. They were revealed to man for the purpose of enlightening us and making our lives better. I don't see any of that sense of purpose in what is today called conservatism. Somewhere around the time of Ronald Reagan, there began to be a denigration of government, what we do together as a people. And the old phrase was that's originated from about the Reagan era was, government's not the solution, it's the problem. That sort of feeling that anti-governmental feeling, which has now flourished into burn it all down kind of approach to it. That's not conservatism. That's not how Lincoln felt about it. Grant founded the Department of Justice because there was a purpose in trying to help the freed slaves become assimilated into society and have rights that were protected. And Teddy Roosevelt he was the first progressive in American history. Conservatism and progressivism are not at odds with each other. They can be embodied in the same person. He knew that conservative values from the Bible included looking out for the needs of the least of these, including all these workers, those who were laboring and actually building the wealth that was then becoming characteristic of the American economy. Eisenhower used the government to build infrastructure. The interstate system is still labeled as the Eisenhower interstate system because he's the one that originated it. These were all men who were Republicans and conservatives, but they knew the value of doing things as a people through the governmental resources. That's the kind of conservatism that I still belong to, and I don't find it in either party. So you're right. Today, you have to look outside of parties for solutions. It's not going to happen if we just allow this partisan bickering to be the only way that political discourse happens. It's useless. It's harmful. It's tearing us apart. Health system reform is one of the very few things that will bring us all together.
And it does seem that the only way to do that is, as you said, you may need to go directly to the people via blocking the word.
A ballot initiative.
Yeah. Yes, a ballot initiative, that a referendum directly, which we've seen lately is occurring in various states, that there are ways for people to say, we actually don't agree with the majority in our legislatures on this issue. And it'd be great to see if that happened on the healthcare issue. Because I don't know if we're at the place anymore. You mentioned in the book the Harris-Wofford moment.
Yeah.
And that was actually a moment where a politician managed to make things change, to change the conversation. And I'd love to see another one of those moments. And I wonder if that's possible in today's climate, or maybe we just need to try all paths to victory, that we hope for that moment while we simultaneously work from the grassroots.
Yeah, the Harris-Wofford moment, just to briefly sort of characterize it.
Please do.
Mr. Wofford was the Secretary of Labor in the state of Pennsylvania in the early 1990s, when unfortunately the then sitting senator in Pennsylvania, Heinz, died in a helicopter crash. And so there was a special election to replace him. Wofford served in the cabinet of the then Democratic governor of Pennsylvania. Heinz was a Republican. The National Republicans chose a former governor of Pennsylvania, who was then serving as the Attorney General of the United States in the first Bush administration, Dick Thornburgh, to be their candidate in a special election. And he was very popular as governor of Pennsylvania, so he had an immediate lead. The Democrats sought for someone with the same kind of name recognition, who was wealthy, who could lead a campaign in the shortened season of a special election, and couldn't find one. So the governor tapped Harris-Wofford and said, "You take it on." Wofford was nobody, a member of the governor's cabinet, but this was his first race, and he wasn't well moneyed, didn't have a whole lot of support, and he started out canvassing and giving neighborhood discussions, and quickly discovered that health problems were on people's minds. Costs for healthcare were rising rapidly then, as they still are now, and had been for a number of years back then in the early 90s. And Wofford happened on a phrase or two about healthcare that resonated continuously and consistently across the state. Something about how everyone gets, by constitutional right, representation in the courts if they need it. Why shouldn't everyone be able to get to see a doctor if they need it? That sort of simple idea resonated, and he was 40 points behind in a race that was only a few weeks long, and he came roaring from behind with that phrase and continually pushing that, and won that race by 10 points. That was a galvanizing moment for politicians all over the country. They suddenly realized, it dawned on them for the first time, that healthcare was a priority issue with American voters. Bill Clinton, who was then governor of Arkansas, and thinking about running against George Bush in the presidential race in 1992, actually for a moment considered putting Wofford on the ticket if he were nominated, but he certainly called Wofford and his political consultants to figure out what was the secret sauce for that victory. And that is the reason why Clinton made healthcare his priority issue in the 1992 campaign. And of course, we all know he ran a successful campaign and ended up being president for 2 terms. Every first-term president elected since then has known that he needs to run on a healthcare issue. The person who replaced Clinton was George Bush, the second George Bush, and he ran on Medicare pharmaceutical. I mean, he knew he had to have a healthcare issue. And the next first-term president was Obama, who ran again on healthcare. And even Donald Trump ran on the issue of protecting Medicare. So everyone knows how important this issue is to the American people. It galvanizes them. In my state of Utah, a very red state, what's the #1 issue? Healthcare costs. That's found consistently over and over again because all Americans know they're one illness or injury away from personal bankruptcy, and they may not be able to get the care they need for themselves and their family. This is an issue that will galvanize us as voters across partisan divides because we all need it. It doesn't matter how you identify yourself. And that's why it's highly likely that there will be another Wofford moment at some point that will help us push this agenda forward. It's also true that even red state populations will vote to make sure that people have the care they need. The proof of that is that 8 red states have, over the objections of their legislatures, have passed Medicaid expansion, including my home state of Utah. It's that important to us.
Yes, and as you've said, it seems mostly important to galvanize the people specifically, because while it's a way to get elected, it hasn't necessarily translated into a way to actually change healthcare in the country. I mean, yes, it has changed, of course. We wouldn't have passed the Affordable Care Act without the fact that people have been pushing, but that doesn't mean that obviously the Affordable Care Act has been a problematic piece of legislation, and we're not done talking about it or denigrating it or trying to make it better. And we'll still work on the way to get to the solution. We just know that, yes, people care.
Yeah, the problem is that if, let's say, we get a Harris Wofford elected, and there have been a number of people with good intentions, especially in the healthcare arena, elected since Bill Clinton was elected in 1992 with the same good intentions. But the Clintons are a good illustration of what happens once you get inside let's say the Congress, or at least in the major arenas, either in a state government or the federal government. And that is the massive financial resources of what I call the medical industrial complex then come into play. These organizations have $4 trillion in revenues. That's how much we spend on healthcare in the United States each year. They've got all those resources, and they're able to bend the will and the interests of our legislative bodies, either at the state or federal level, to their interests. So Bill Clinton arrives in Washington, and he is persuaded by this massive lobbying force, and they outspend any other lobby. In fact, I've heard statements that say that medical industrial complex outspends in political campaigns and lobbying efforts all other lobbying interests combined. I'm not sure if that's true, but let's just say it's a massive amount of power. What they write in their boardrooms, let's say at the health insurance corporate interests, what they write in their boardrooms is on the tongue of our members of Congress for the evening news cycle that same day. That's how powerful they are. They can transmit, they can communicate, and they're the ones that have taught the American public through many, many years of advertising that anything other than the private for-profit health insurance model is terrible. It's government, it's intervention, it's socialized medicine, it's all those bad things. They're the ones that confuse it all the time. With that kind of power, they twist and turn the efforts of Congress, and they get placed so they can actually write the legislation. That's what happened to the Affordable Care Act. It was written by the health insurance industry. When Joe Biden was standing behind President Obama while he signed the Affordable Care Act into law, the share price of United Health, which is the largest HMO in the country, I've forgotten exactly what it was, but let's say it was X. When Biden gets sworn in as president of the United States about a decade later, it's about 10X. There was a tenfold increase in the value of those stocks because the Affordable Care Act was written by and for the health insurance industry to make them more wealthy and more powerful, and therefore more difficult for us to defeat as a people. That doesn't mean we can't do it. It's just an answer to your question, what happens to these Wofford moments? Well, we the people still have to be vigilant. We can't, it's not a one-time election thing. We have to be on guard. We have to keep working at this. This is why I travel all the time. I want to get in front of people, everyday average Americans, and motivate them to bring their neighbors with them to the ballot every year, every time there's an election, and restate again, what are our values? What is it that we want? And let us keep pressing this, because eventually we are going to win. We are going to win this fight.
I do keep reminding myself of that, about the arc of justice. It will eventually get us there, but it is a long fight, and we need to keep providing these galvanization moments and keep this conversation going and bring more people into it. It's frustrating for me as a student of rhetoric is watching how the language has been nicely shaped by the medical industrial complex, so that one is constantly trying to take the words back and say, but that doesn't really mean what you think it means, or this is what we really mean by how we want to run healthcare. As you said, socialized medicine does not just mean we want to give medicine to people. We do want to give medicine to people, but that's not what socialized medicine is. That actually is talking about a government-run program and public ownership, and we don't have to have that. There are countries that do have that, where their healthcare system works, but this is a very large country, and we are designed to function as a conglomerate of states, where the state-by-state approach may have to get us there, because we are happily a diverse nation, but also unhappily a diverse nation, in that it is difficult to come together with, even where we all agree this is not working, that the solution is difficult to find. And I'm constantly thinking about the way we change minds on that language. My husband, John Finley, as an Army veteran and family business owner, entrepreneur, has always been able to talk about that aspect of the various groups of people who have been against more public health care or healthcare reform, are often other veterans. They tend to be on the conservative side, and business owners don't want to hamper business with it's very expensive with healthcare and having to provide it for all. And of course, that's one of the huge problems with our healthcare system, is that in fact it isn't good for business. It's good for the medical industrial complex, but it's not good for the people who are trying to run their businesses. It actually hampers people from getting ahead and starting businesses, because that's another requirement, is how to juggle the healthcare for employees and how all this is designed to function around your workplace, that private healthcare comes through your job, and that is limiting in that factor. The other factor being, of course, he always argues that strong healthcare system means protecting the country. And it's a little scary when after he would say for years, you know, one engineered virus could come along and destroy our workforce and keep people from going to work and shut down our country. If we can't be out there doing vaccines and taking care of people, this is important for the workforce. And he did get some people to say, yeah, you know, I guess you're right. We don't want people to be able to use what is essentially a biological weapon to destroy our workforce. That could destroy our country, just as any other terrorist weapon could do. Yesterday was September 11th, so of course that's on your mind. But of course, then we had a presumably purely biological virus, not engineered, not weaponized, but it did a great job of shutting down our economy for quite a bit of time. And that doesn't seem to have actually galvanized people as much as it should. And so I'd like to talk a bit about how the current state of healthcare is bad for business and bad for the country in those aspects, that the country is less safe and less productive. If you could address some of those ideas.
Yeah, so first of all, our healthcare system in the United States, which really isn't a system, it's decidedly a non-system, was put together in a series of uncoordinated events that really are irrelevant to actually caring for people. They were answering the needs of something at the time. And the employment-based aspect of American healthcare financing is an accident of history that has to do with World War II. There was a need to build a massive war materiel at the time of the war, while many of the men who would be serving in the factories usually were in uniform and elsewhere. So there needed to be a recruitment of the Rosie the Riveter and lots of women to that workforce at a time when it was also in the national interest to keep inflation from spiraling out of control. So Congress, in its wisdom, placed a limit on wages, which meant that employers had a hard time offering enough money to make it attractive for women to leave what they were otherwise doing, mostly attending to the home fires, and joining the workforce. So there was a brand new shiny object out there, known now we call health insurance, that the government used as a tool to be attractive. They gave a massive tax credit to the employers who would provide a health benefit, an insurance product, to their workforce. And there were a lot of other economic measures that were invoked during World War II in order to keep the economy humming, but not getting out of control with inflation or other problems. That was a key part of it. So at the end of the war, all of those wartime measures were relinquished, except the tax credit for employers. I'm sure that was because health insurers realized what a goldmine that was. And then I'm sure they made sure that that piece got left in place. While all of our allies, for instance, the United Kingdom, were actually building towards a community-wide solution that wasn't attached to the workplace, that for healthcare, so that everyone could be cared for wherever they lived and however they worked, or even if they were disabled and couldn't work. We in the United States allowed a financial model to infest our tax policies. And that financial model being the private for-profit health insurance model, which is the world's worst financing model for healthcare. It is useless to us as patients and as people. Its only purpose is to create wealth for the very select few who happen to own the shares of those companies. It has nothing to do with actually providing for a nation that has an infrastructure need to make sure people are healthy so they can go to work, so they can be creative, so they can keep us at the cutting edge of the world economy. In fact, it does everything possible to put a drag on our economy. I mean, employers, if they're busy making widgets and they have to stop and think about how to best put together a health plan for their employees, when that's not what they do, Of course, that's a drag on the economy. And that has been true since World War II. So well over 75 years now. It was an accident of history. It has nothing to do with what's the right way to go about funding this. And to prove the point, once it became clear a couple of decades later that there were vast sections of the populace that were being left behind and were not able to get the care they needed, Congress went back and created whole new massive federal programs, sometimes shared with the states, that were funded publicly to try to fill those gaps. And that's the reason why we have Medicare and the reason why we have Medicaid, and eventually the reason why we got the Child's Health Insurance Program, CHIP, because there are huge gaps. Because the health insurance industry wasn't created to take care of soup to nuts all of the health problems that the populace in the country has. It was created to make itself wealthy, not to do good for healthcare. So we kept having big gaps. And as long as we rely on that business model, which the Affordable Care Act, which is neither affordable or caring, actually does, it continues to rely on that business model, and they continue to make a lot of money at the expense of all of us. There are going to be gaps until we get rid of that business model and all of its inefficiencies and the waste that it produces and the poor quality care that it supports. We're going to continue to struggle with the very basics of how to defend ourselves from even the simplest virus, much less a complex, vast, expansive pandemic virus that we've recently experienced. That's really what we're up against. We're massively outspending on healthcare. Our economy will ruin itself if we don't stop the wasteful spending that accelerates beyond the usual growth in cost of living year in and year out. You cannot spend 100% of the gross domestic product on healthcare because we've got to feed ourselves. We've got homes to build. We have streets to build. We've got to educate our children, et cetera. All these other activities have to have their fair share. If you spend a growing portion of the gross domestic product on healthcare, sooner or later, your economy will be ruined. This has been articulated best, I think, by former Health and Human Services Secretary Michael Levitt, who basically said that if any country, any nation allows its percent of gross domestic product to healthcare to grow beyond 25%, it will become something less than a first world country. It won't be able to sustain an economy that provides a high quality of life. Well, the only nation in the entire world at risk of crossing that threshold that he set down, that 25% threshold, is our nation. We're at about 20% of the GDP that's devoted to healthcare, and everyone else is about half that in the first world. We cannot go on like this. It's not possible. You cannot do it. So we either change, or we as an American civilization are going to become substandard.
And I think that brings me to think all the other things that the World Economic Federation is looking at is simply we're getting to that point in many areas where we are, if we do not address X problem, this country is not going to be the shining example it once was. And I don't feel a need necessarily for my country to be number one in the world. I think it's more important that the world do well, but at the same time, it's deeply embarrassing to feel that we have been an amazing country filled with amazing people, and we can't seem to get ourselves together to come up with a solution which is common sense. That to me, because of my background, it seems that yes, what we need to work on is changing our conversation about, so that we're not looking at the problem constantly from the same way, which is essentially what you're doing. The more that you get in front of people and say, well, we need to do this because our country is going to fail if we keep spending money like this. You don't just keep throwing money at things when they're not working. Everybody knows that, right? We all know that. That's common sense. So, okay, let's talk about the smart way of doing what is sustainable. Granted, sustainability is a bit of a buzzword, but it shouldn't be a problematic one. It shouldn't be a question of being woke to say that we should be more sustainable, because the opposite of that is failing. And we need to not fail as a country. We need to move forward, sustain our momentum, and figure out how to spend our money better and actually take care of people. That you can come to it from a perspective of personal passion, from deep religious conviction, deep humanist feeling, or you can come to it from a feeling of what makes good business sense, what is the best way to organize things. And you can come at it from, well, how have other people attacked this problem? It's a bit difficult when you look at, from our perspective, what's going on with the National Health Service in Great Britain and say, okay, well, they did it. Okay, they're a smaller country. That's true. It's a little bit easier to organize such a thing. They were more devastated by World War II, actually being directly bombed. Other than Pearl Harbor, we weren't looking at this level of, okay, it helps to destroy your infrastructure first, and then you can rebuild. And we were, as you said, essentially patchworking it along the way without having had something devastating. Well, I don't want to devastate my country in order to fix it either. So it requires a lot of work that it makes it in a way more difficult when you have been successful to say, okay, but it's not going to keep being this way. We're not going to stay first world country if we don't change. And I wanted to talk about, go ahead.
It's a real unique challenge that American civilization now has, because, the history of the world, the recorded history of the world, is one major civilization after another, rising and then falling into the ashes because they cannot sustain a level of success that keeps them growing, successful, nurturing their own population. They lose sight of the things that make a civilization strong. And here's where the wisdom of the ancient world, as reflected in the Bible, actually comes into play. This is why the prophets of the Old Testament, looking at the people of Jerusalem after they have had their civilization destroyed by the Babylonians, and saying, you know what? You were ruling with force and harshness. You were not actually taking care of the people you were supposed to be taking care of. This is the prophet Ezekiel's statement. You should have been healing the sick. You should have been tending to the wounds of the injured. You should have been looking out for the orphans and the widows and the aged and the poor. These are the things that you should have been doing, and you failed to do that. When you don't do that, at least that's what the Bible teaches, and I think the Quran teaches it, and I think all kinds of religious sacred scripture teaches it. If you don't do that, your society isn't strong, and you will not be able to stand for the long term. We have got to reinvent ourselves as a more caring, more introspective, more loving, if you will, more nurturing kind of society, or else we're going to fall down. I am in this fight because I remember what it was like to live in the 1950s. There are lots of flaws there. I recognize the civil rights movement was just beginning to happen during that time. And it hadn't been long before that, since women had the right to vote. I get that there have always been flaws. We've had fatal flaws that we've, however, always found a way to correct. The healthcare system that we've unfortunately allowed to develop, this is a fatal flaw. If we don't fix this, and I see the cracks of it all around us, the fact that we are so at each other's throats right now in the United States, that's new to me in my lifetime. It's not like what it was in the past. And partly the reason, I think a great part of the reason, is a whole bunch of us got left behind, a healthcare system that didn't care about their needs, that didn't look to their needs, that in fact would rather sell them some bill of goods rather than actually care for them. And they got frustrated, become angry, and their reaction is burn the whole thing down. We turn around now and put hands on and care for everybody, and we will give everyone a dog to be in the fight by doing that. This is the way forward to healing our civilization. And if we don't do it, we won't have a civilization to heal anymore.
Because, of course, as history does tell us, the more you have people left behind, eventually they will do something about it.
Exactly.
They will be driven by despair. You will become weak. You become subject to conquest, as with the Babylonians. You become subject to such internal division that you crumble. There's no good excuse for keeping on the way things are going when there's too many people who are not doing well. That's the Army veteran in my household will point out, this is why people keep guns. This is why people are they recognize that we may come to a point where we collapse enough that there are enough have-nots that are frustrated that they haven't ever been listened to, that clearly there's nothing the government's going to do to fix things for them, which is, of course, why I think what you're doing with your project in Utah, in trying to say, okay, if you can't work with the United States government, with Congress, if this is not getting across these policies that we need, that the people clearly want, okay, well, let's look how we can do this in our state. Let's look how each group of people can organize their people, bring more people to the table. So I'd like for you to talk a bit, if you would, about what you're doing in Utah, about your, let's see, the common sense healthcare for Utah.
Right.
And also, you mentioned, as an academic, this of course made me really happy that you wanted to organize an economic study of the effect of proposed healthcare reform in Utah. So I'd love to hear about what you're doing, how that's going, and where people can pattern themselves perhaps on a common sense approach moving forward with healthcare and tracking healthcare reform. Because I think if we don't really prove to people, if we have a good test case for this is what they did in Utah or New York or whatever state gets across the finish line first, that says this is what they did, this is where they're going, and these are the results they're getting, this is doable.
Yeah, so to finish the thought about the importance to the nation of working on this, after World War II, there was a moment in time when the United States did a very generous thing. They reached across those enemy lines and provided support and sustenance for the former enemies in Germany and Japan, and helped rebuild those nations. That generosity, over a very short period of time in the world's history, at least, created some very strong partnerships and allyships between the United States and those former enemies. Germany is one of our strongest allies these days. Same can be said of Japan. In part, that rests on the foundation of the Marshall Plan. What we're looking for as we do health system reform is a similar moment of generosity. When we start loving each other and we're magnanimous to each other and we reach out and care for one another, we have a hard time being enemies anymore. That's the point of this. And in Utah, our group has realized first and foremost that every person in Utah, as well as the rest of the country, knows in their heart, or at least somewhere in their mind, there's a corner of worry and anxiety because they're not sure that when they need health care that they'll be able to get it or be able to afford it. The rate of bankruptcy in the United States related to healthcare causes now up beyond 500,000 episodes per year. There's a lot of people who, even though they have insurance, and most of the bankrupted families from healthcare actually were insured at the time the health incident happened, insurance is no longer providing financial security against healthcare. So that we begin by knowing that the people out there, our fellow citizens in Utah, are worried about this, and polls show it. Repeatedly, the number one issue in Utah is the cost of healthcare among voters. That's been true for decades now. And what we're trying to do is help people understand why they have that anxiety. It's often the case that people will feel that way, but are not sure why they feel that way. And so their fear is kind of vague, and therefore it's not useful to them. It's not motivating them to do something specific. Our job is to tell them stories. This is why I recently released a movie called Healing Us, because it's full of stories that help people understand how it is that the broken healthcare system plays out in people's lives, and that this story, if we don't interrupt this terrible system or non-system and change it, then these stories are going to happen in every American family. They're going to continue to unfold. So that's step number one. We need to help people articulate that fear. And then once they are able to see why it is they have that and what there is to be done about it, then it's logical for them to help build towards the moment in political history in Utah when we'll all vote and bring in a better system. So step number one, after helping people articulate the anxiety, the next step is the economic study, the actual infrastructure, what it's going to look like. How can we actually practically do it? We hired an economist from the state of Massachusetts, Dr. Gerald Friedman at the University of Massachusetts in Amherst, to come to Utah, use the data resources that exist there, and characterize what we're spending on healthcare now, where it's coming from, from the federal government, the state government, from various other sources, and then how it is spent. How much is spent on overhead and administrative burdens? How much is spent in hospitals? What the prices for hospital care might be? What amounts are spent for medications, et cetera? All that characterization, and then let's create a new system for managing this, something that's much simpler from an administrative perspective, and that improves care, because that's in the nature of how you restructure the organization. You actually pay for and induce and promise a better experience for the patient, a better outcome. So he does all that. He makes his economic assumptions and then forecasts what it'll look like down the road after we implement this, to answer the question, can we afford this? Here's how much we're taxed for today. If we were to do this change, how much will we be taxed for in the future? What will it look like? That economic study in its draft form is out now, at least among those of us in Common Sense Healthcare for Utah. And it says what you'd expect. If you actually address the real underlying flaws in American health financing, and you take away the business model that is costing us 25-30% off the top before we even begin to pay for care, if instead you have a financing system that requires less than 5% overhead, you've got a margin there, 25%, that you can spend on the care of people and actually have money left over. So what this modeling proves, is that down the road, if we make this change, the percentage of the gross state product in Utah going to healthcare doesn't keep rising. It actually starts to fall and then eventually stabilizes at a lower level, so that we can preserve all the economic resources we need for the other parts of our lives that are also so important. That's the essence of what and now our job is to try to articulate that and communicate that to the highest levels in Utah, but also to every single person across the state, all of the electorate, so they can get ready. We are carefully planning for a 2026 ballot initiative to give them a chance to vote on it. I think they'll vote for us. I think they'll do it.
Well, I think that it's an excellent way to go about approaching the problem, is very simply saying, no, we actually have addressed the issue of how we're going to pay for this. How much is this going to cost? And I think that's been one of the easy ways that many politicians have gotten around the healthcare issues. Like, well, I know I got to have something about healthcare, but then how are we going to pay for it? What exactly it's going to do tends to be, well, it'll get there. It'll get there. And of course, by the time we get there, it's been written by lobbyists. It's been designed not to do any of the things we hoped it would do. And we really need to approach it in a scientific way, which is, what does a professional working on this forecasting with hopefully relatively high confidence in the numbers say, okay, we not only is this as good as what we have, it's actually better. We're going to bring costs down. This is good for everyone. This is good for the country. It's good for the state. Let's get this going, and hopefully in Utah. And I feel like Utah would be an excellent banner to banner sort of state, because it's not Oregon where I live. It's not, that's like the bluest state in the union. Of course, you guys are going to do that, and you're going to spend so much money, and that's just what but you're not that, you're not that populous. You're not, whatever. You crazy people do that over there. You like to burn things in the streets, don't you? There's a lot of ways people view where I am, and it makes it hard for Portland, Oregon to be the place where these ideas come from. They're going to be labeled as a crazy liberal idea that really doesn't look at the economics of it. And that's, of course, what we're trying to do, even though, of course, we're in Portland, Oregon. But, my husband was a weirdo growing up being a conservative in Portland, Oregon. But they do exist. And again, he's at that place where he finds the label problematic because he doesn't feel that he's changed, but the world has changed around him. And I feel the same. Of course, I said growing up that I thought I grew up with a Democratic family, and I thought we grew up in a blue collar town, thought we were fairly left wing, and then watched as everything shifted in the country and said, why do I feel like in the world, I'm a moderate? Globally, I'd be called a moderate. But in America, somebody's going to call me a commie just because I think, shouldn't we do something about these poor, starving children that aren't getting a good education? What about the healthcare? My father was a doctor. My mother was a nurse. Healthcare was really important to my family, and I had the benefit of it, of course. It's not something that I've struggled with until I became an adult and suddenly had to deal with. It's workplace healthcare. It's not the fact that my father could make sure that the very best surgeon in the hospital is there to do my mother's surgery, that the chief anesthesiologist is going to make sure, because she's a little bit tricky with that. When you have a medical family, which you must experience, is you realize you have a power that other people don't have. And that isn't the way it should be. It should be that the best of care should be available for the least of us as it is for the privileged. Yes. And of course, I feel that with the veteran in the family, that actually we're pretty happy with the healthcare at the VA Medical Center where we go. There's some wonderful doctors, wonderful nurses, but the system is the difficulty, and how the money gets spent, how everything is organized. And that's where my personal experience there, and seeing the need, but everybody has that personal story. They've seen somebody get ruined. They have friends that have gone bankrupt, that have had their health ruined because they haven't been able to afford health care. They get the wrong health care. Their insurance won't pay for the correct health care. You write these stories in your book that it's so frustrating and makes you so angry just to say, but why doesn't anybody address this with common sense? Of course, you should get the person the care they need right away, and then you don't develop a huge expensive problem down the line that bankrupts the family. It's going to cost a lot of money to the local government, to the local economy. We want to keep our states, our local economies healthy. And the way that we need to do that is by attacking this underlying problem and saying, we need a healthy populace. It is important not just for who we are as a people, as humanitarians, as Christians, as Muslims, as Jews, as any other of the um, religions around the world that do address the importance of taking care of people, which is essentially most of them. I can't speak for everyone. I'm not a student of all of them, but
Mm.
most of us do care about people when we come down to brass tacks. And that's the way to approach it. But you don't just have to approach it that way. You can approach it as it's good business, it's good economics, it's it's good for people, it's it's good religion. These are all things we'd like to be good with,
Yeah.
theoretically.
This you're reciting the wisdom of the ancient scripture. Uh, this is what the prophets have repeatedly said. If you really want to thrive, you individually, if you really want to thrive, then create a society around you that cares for each other. When you do that, when you're generous, when you're magnanimous, when you put hands on and you care for people, you create this strength of association that actually makes individual success possible. Absent that, you are living a short-term life as a civilization and as individuals. You're going to crash and burn if you don't care for each other. It's as simple as that. That's the ancient wisdom that you'll find, I think, in every single society, every single culture, every single belief system. And that includes the belief systems that don't believe in an all-knowing, all-loving God. They're all founded on the idea that we care for each other or we don't succeed. So the Common Sense Healthcare for Utah, we're just simply trying to teach those principles. And I believe those are very conservative principles. And people on the other side of the political aisle are free to believe, and often do, that those are very liberal principles too.
And again, we come to the definition of what it means to be liberal and conservative. And I find that, well, when you ask me the question, do you want to preserve these principles? Well, of course. Why wouldn't we want to live by those principles? It has been proved over and over by history, of which I am also a student, that without this is how civilizations fail. And what makes civilizations strong is when you build together and you are paying attention to what is, people joke about the greater good, but it does need to exist. That does need to be a part of the discussion always, and not just the, well, I need to do what's right for me, because what's right for me is going to have to take into account what's good for the country. I drive to work on streets that were put together by for the collective good. It is not my street, but it's a street for everyone to drive on, gets everybody to work. I believe in public schools because I think it's much better for society if everybody has an education. I have plenty of educational reforms in mind as well, because I don't think we're getting where we need to go with that either. But at the core, that's how we thrive as a society as well. I don't want to live amongst people who can't contribute, because we do create a greater good together. And I'm not going to thrive if I don't make sure that the other people around me are thriving and providing me the food that I eat, that are becoming educated so they can provide me my health care, my entertainment, my food for thought, all the things that make life worth living and make life livable.
You know, these principles were written right into the Constitution. This is why the phrase that the government of the United States exists to promote the general welfare exists. It's because those framers of the Constitution were well schooled in the principles of the Bible. They understood them, they embraced them, and they wrote them into the founding documents of our country. They knew what they were talking about. It makes perfect sense that if we really want to thrive, you use the example of a communicable disease threat in our conversation earlier. If we want to thrive and be ready to handle whatever the threats are that come along, we'll take care of every single episode of illness. That's so that we can be alert to when there is such an event as a purposefully introduced, let's say, viral threat into the country. We only know about that early and are able to do something about it if everyone who has symptoms has a way to get care. And they can bring those symptoms to the attention of the proper person who can identify something new and different that might be a threat to everyone else, and we can do something about it early. We can only do that if we're taking care of each other. That's why it's simply the case. We're not strong unless we're caring for everyone.
One of my favorite phrases from a founding document is, in order to form a more perfect union. And I think often of what the meaning of perfect is, because it means thoroughly done. That's from its Latin roots. And the fact that we're trying to become more perfect is in fact implying we're not done, and that we were never done. When we wrote our original document, there is the idea that it is going to change over time. We have the ability over time to do amendments to the Constitution. That change is inevitable, and it was written into that, but that the goal of change should be, let's make this eventually perfect. We want to come to a place where this project is thoroughly done. And to be perfect is to say, this didn't work. We threw something together after World War II. We recognized we needed somehow to get people to work. And this is a way to get them to work when we don't want to we can't raise wages. Let's get them some other way to inspire them to work. Well, it's not covering everyone. We'll do this. We'll patchwork. We'll patch things over and see if we'll get there. But that's not the perfection we're reaching for. We're reaching for we need to continue to work in the spirit of the founders of the country. We are given a path to do that. And we don't need to say, well, we need to stop changing because our country was founded a very long time ago and they knew what they were doing. Yes, they did. And by knowing what they were doing, they're saying we're going to continue working together for the common good, for the general welfare, and to create a more perfect union. It's a great document.
Yeah.
We used to have to memorize the preamble of the Constitution when I was a kid. I doubt they do that anymore.
I doubt they do that anymore. I agree. It's time to reconnect with that.
I see we've come to we've been chatting for a good long hour, and I've really appreciated your time. And I think we've had a wonderful conversation. There are a couple things I wanted to ask from you, which is there a way to see your film?
Yes.
Healing Us?
Yes.
For our viewers.
Healing Us is a documentary film that's now streaming on Amazon Prime. I think it's rentable for a couple of bucks on Amazon Prime, or alternatively, and I'd recommend this whether you look at the film on Amazon Prime or not, you can see it streaming through the website that we've created for the film, which is healingusnetwork.com. We created the website as a place for everyone with a concern about health reform to come together and learn from each other. So we've created a platform that we hope will unify people from all across the country, because as I've already mentioned, this looks like it's going to be a state-by-state process, but that doesn't mean that we can't be, we in Utah, of course, have our own issues and we need to struggle and work on those, but we need to be supportive of the people in New York and the people in Oregon and all over the country who are working on this. That's why I travel outside of the state of Utah. I'm currently in New York, where I've just last night spoken with a group of people working on the New York Health Act, which is a single payer piece of legislation before the legislature in New York. They don't have ballot initiatives in New York. But I've also recently traveled to Minnesota for the same purpose, to meet with the same kind of people in Minnesota. And in the past, I've been to Oregon and Washington and various other places as well. We need to connect with each other, and that's why healingusnetwork.com exists. It's a place for us to get together, share our stories, share our successes, be able to ask questions about the problems we're encountering, because the wisdom of the group is going to help everyone. Sooner or later, we'll push a state through, and that'll make it easier for all the other states. I don't care whether it's Utah or not, but I don't want Utah to not be in the thick of it, because even if we're not the first state, we'll learn from whoever is, and maybe it'll make it easier for us to make our step. So that's where you
Somebody
can see
has to fly in front and cut down the resistance for everybody coming behind.
the last time I'm aware of that there was a ballot initiative about single payer was in Colorado in 2016. And the Colorado group, where I've also recently been to speak, actually, the Colorado group raised $800,000 for their ballot initiative campaign, which they thought was a handsome amount of money. But they were outspent by the insurance industry 10 to 1. The insurance industry spent $8 million opposing the initiative, and they lost. So we need to learn from that. We in Utah have observed that, and we're determined to outraise $800,000 by several times over, because we know we're going to be facing a very huge opposition who will try to muddy the waters and frame it as something really awful and horrible and just cause people to be afraid of it. We need to be able to clearly articulate it. I hope what we learn will be useful for everyone else. But if all states are busy working on this, there's no way the health insurance industry can spend $8 million in every state. That's part of the reason for encouraging programs. I'll be in Fort Collins in a week or so, Colorado, where I'll again be speaking on this and showing the film. The film is intended to be a way, it tells a bunch of stories. It helps people get a few of the facts that are important to this. It's a way to bring the general public into this discussion, to help them bring it forward in their mind. I told you that everybody's got the anxiety. So to help them, I help the individuals feel that anxiety, realize why they have it, and that there is a way to move forward. And then they can all use the film as a connecting point. So I hope your viewers and your listeners get a chance to see the movie, and then we'll give them an easy way to join in with the movement.
Excellent. When we'll put the notes and the information in the notes for the video, just to make sure everybody can find that spot. And so again, thank you so much for your time today. I wish you a safe journey home. Godspeed. If you're even going home, are you going home?
Yeah, I'm going home. Got to go see my wife.
Okay. So safe journey. Take care, and we'll be in touch.
Okay. Thank you.
Thank you.
Bye.